What is cancer? A simplified guide. Let's follow Sofia, a journalist preparing an article on cancer. She is interviewing Dr. Lucas, a medical oncologist who deals with multiple cases of different cancer types every day. Watch this video series to understand what cancer is and how biomarker identification can help fight cancer.
Hello, Dr. Lucas. Could you help us to understand what cancer is?
Sure. Cancer is a genetic disease that occurs when cells in the body begin to grow uncontrollably. Normally, cells grow, divide, and die in a regulated manner. But in cancer, this process goes haywire. The abnormal cells continue to divide and accumulate, forming a mass called a tumor. Cancer can occur in almost any part of the body. Depending on the primary tumor locations, we can refer to the disease, for example, as lung cancer, colorectal cancer, ovarian cancer, and blood cancers, such as leukemia. Sometimes, solid tumors may continue to grow and therefore progress. It can also spread in other parts of the body through the bloodstream or lymphatic system, and this is called metastasis. This ability to spread is what makes cancer particularly dangerous. The most common organs that cancer can spread to are the brain, liver, and lungs.
Interesting. So it is important to detect it as soon as possible. But how does cancer start? Does it have anything to do with genetics?
Indeed. Let me explain. Our bodies are made up of trillions of cells. Each cell contains chromosomes that carry information about our genetics. This information is stored in DNA, which contains all the instructions for our body to perform its functions. During our lifetime, our cells divide, every time making copies of the DNA, like making copies of an important document. Sometimes, when the cells divide, errors are made in the DNA. Most errors are corrected, but others are not. We call these errors mutations.
If you want to explore the different types of mutations associated with cancer, scan the QR code.
In the case of cancer, these mutations make the cancer cells to behave differently, continuing to divide and accumulate at a faster rate than normal cells.
Are there particular causes for these cancer-related mutations?
Mutations could be caused by multiple factors, and depending on which factors are involved, the cancers can be classified into two groups: hereditary or sporadic cancers. The cause of hereditary cancers involves mutations passed down from generation to generation. However, being born with an inherited mutation doesn't mean that a person will develop cancer, but it does increase their risk. It's important to be aware that hereditary cancers are much less common than sporadic cancer. In fact, most cancers are sporadic. The mutations in sporadic cancers can result from random mutations due to aging in combination with various risk factors, including smoking, dietary habits, alcohol consumption, sun exposure, radiation, and air pollution. Therefore, these mutations are acquired during one's lifetime.
If you want to know more about hereditary or sporadic cancer, scan the QR code.
In many cases, it is important to identify specific cancer mutations. These mutations can serve as biomarkers, providing important cancer-related insights to help clinicians make informed diagnosis and treatment decisions, similar to other well-known disease-related biomarkers, for example, blood sugar levels and diabetes.
Thank you for providing all these explanations.
What should you have learned from Dr. Lucas's interview? 1. Mutations in DNA can initiate the development of cancer, leading to the formation of a primary tumor. 2. The primary tumor can continue to grow, a process referred to as progression. It can also spread to other parts of the body. This is called metastasis. 3. Mutations that cause cancer may arise from multiple factors, including environmental exposures and genetic predisposition. Depending on which factors are involved, the cancers can be classified into two groups: hereditary or sporadic cancers. Looking forward to our next episode with Dr. Lucas to discover how biomarker identification can help fight cancer. In case you have any questions, please talk to your doctor. This video is for educational purposes only.